Hello, and welcome to part 5 of our 5-part series on ileostomies. My name is Sophia, and I'm one of the ostomy nurses that works here at Dartmouth-Hitchcock. In this section, we'll talk about support before and after surgery. We realize that this may be a huge physical and emotional adjustment. It is okay to grieve that change, but it's also important to keep moving forward. You can live a full and fulfilling life with an ileostomy. You can always make an appointment with one of the ostomy nurses, and we can facilitate an appointment with an ostomy visitor who are past patients of ours. They would be around the same age as you and would have had the same or similar surgery that you are scheduled to have. We do have a support group at Dartmouth-Hitchcock Medical Center that meets on the third Wednesday of each month at 4:30. Please give us a call to sign up and to be sure the session is still running. If you do not live close to Dartmouth-Hitchcock, please check the United Ostomy Association of America, or UOAA, website for support groups that may be closer to home. More information about resources is available at your sighting appointment. Now we will watch a brief clip of people's experiences with ostomies. I should mention that there is one comment regarding a colostomy in the clip. Colostomies are ostomies created with the large intestine, which are very different from ileostomies.
And he says, you have more than a hemorrhoid, you have a tumor or cancer or something like that, just like that.
The doctors told me, that I was never going to live to see the age of, 10, 15, 20.
It scared me. That scared me.
It's scary to look at, to wrap your head around that fact.
I was just too sick to hide anything anymore, and
I couldn't get to work. I'd have to turn around and go home and clean up. And
I would call my friends, my guy friends, and they would come carry me to the bathroom.
There were times I laid in bed, crying, thinking to myself, how am I going to get through this?
We didn't even know what an ostomy was, and that she needed to have it to survive.
And he said, you'll have a permanent colostomy. And I said, colostomy, like the bag thing?
And that was something I definitely didn't want to happen.
And my thought was, I do not want an ostomy, something hanging off of me, and anything I could possibly do to keep myself quote-unquote normal is what I wanted to try to do.
It took about a year before I could joke about having colon cancer, and even these days now when I perform in comedy shows, I dare to go there with comedy because I want people to realize that colonoscopies are really important.
And it took me until about a year after my surgery before I really felt completely back to normal, and I tell people that.
I think most of it is based on ignorance, because I would give them anesthesia, they'd go home and I'd never know anything about their life after that. Lo and behold, they diagnosed me with Crohn's, and I reluctantly gave them permission, dreading the fact that I would wake up with an ileostomy. And I did. I was wondering if I'd ever play golf again. Now I play golf every day.
I do hockey, track, and basketball, and soccer.
I like going and walking around and stuff with Dad, things that normal average kids do.
I play football on the weekends sometimes, Of course, my mom thinks I'm crazy doing that. It's just something that, I'm comfortable with, and an ostomy it doesn't prevent me from doing anything at all.
In the last 18 months, I started playing hockey again, checking league and everything. I am an active state trooper. I wear a 30-pound gun belt. Basically, I tell everybody what you want to do, you could do.
I've been rock climbing for about 2.5 years. I feel like I'm climbing better than I was when I was 34 and healthy and without an ostomy.
Caving is the thing that I love doing. After I recovered, now I can do this again. It's absolutely wonderful. I crawl through places, I go up and down on ropes to get into vertical caves.
It's a huge adjustment to go from being the sick person to being the well person. I think that's the bigger adjustment than having an ostomy, But once you finally reach a point of accepting everything and feeling positive about everything, you kind of feel like you can climb over any rocks and hike up any mountains and just keep going from there.
I saw the doctor so much in that time of preparation. I started calling him the Rear Admiral. Not to his face, just, you know, for fun. And then the morning of surgery, the Rear Admiral comes in, and I had to ask him, do you think it's really a good day for surgery? And he said, why do you ask? I said, well, you've got those little pieces of tissue stuck to your face.
Thank you for watching this video, and please visit our other ileostomy videos.